Wakayama Prefecture, with Wakayama Medical University, is located in a little west from center of Japan, close to Osaka and Kyoto. It takes 40 minutes by car from Kansai International Airport and 70 minutes by train from Shin-Osaka Station. Wakayama Medical University traces its roots to Dr. Hanaoka Seishu, famous for succeeding in breast cancer operation under general anesthesia, first time in the world in 1804. The school emblem features the flower of Datura called mandarake in Japanese, from whose leaves Seishu Hanaoka succeeded in making the anesthetic. Dr. Hanaoka put katsubutsu-kyuri in the basic concept of the school. Katsubutsu-kyuri means that any symptom should be individually taken into consideration as one has its own body constitution. The medical saint, Dr. Hanaoka Seishu from Wakayama Prefecture, performed cure and care 200 years ago, when there was not even the concept of anesthesia and education doctors. Wakayama Medical University fosters medical professionals with care mind inherited the spirit of him. The first president is Dr. Kotake Yashiro, who is one of the leading scientists of biochemistry, especially the research of tryptophan metabolism study. President Kotake shows the attitude of the doctors and medical researchers as words to be sent to the graduates. He tells that working hard is to get close to the nature and staring at it. Wakayama Medical University was founded at Misono, Wakayama City in 1945. In 1955, Wakayama Prefecture bought Kihoku Hospital at Nosis in Wakayama Prefecture, and Wakayama Medical University Kihoku Hospital was opened. In 1999, our campus and hospital were moved to the present place, Kimidera. The School of Health and Nursing Science, developed from Nursing College, founded in 1996, was established in 2004 for the purpose of cultivating excellent human resources active in the field of health and nursing. In 2021, the Faculty of Pharmaceutical Sciences was established to foster human resources who can play an active role in research and clinical aspects in wide range of fields, such as medicine, hygiene pharmacy, and drug discovery. At School of Medicine, over 600 students from the 1st to 6th grades study. Medical education in Japan is 6 years. Students learn liberal arts and science for the first 2 years, and basic medical science for the following 2 years. Students choose their interest and study real researches in the labs last 2 months of basic medical science. Clinical science starts in the 4th year to learn diagnosis, treatment, and prevention. After taking objective structured clinical examination, students become student doctors and have clinical training in the 5th and 6th grade in a small group. There is a clinical skill training center for simulating clinical technique to acquire close to practical ones. There is also a clinical skills training center for that. We have postgraduate system in Japan. All freshly graduated doctors are required to partake in 2 years trainee program. There is system of machine trainees and training hospitals. Wakayama Medical University has been boasted top-level popularity. We bring up 60 to 80 trainees yearly, which is one of the largest training centers in Japan. After 2 years of postgraduate system, doctors engage in medical care as residents or campus assistant professors aiming to become specialists. Some of them study for aiming degree at graduate school. We have courses for master and PhD at graduate school. Research environment is also substantial to prepare institute for animal experimentation, radioisotope laboratory center, and central research equipment center for mutual use and clinical research center to support clinical researches and trials. Taking advantage of these resources, we effort to advance research in collaborations with research institutes at home and abroad, has achieved a number of results. In the 1980s, structure abnormalities insulin was discovered and our researchers have produced results, such as the diabetes research named Insulin Wakayama. Currently, we work in cooperations with researchers in institutions, home and abroad, on a variety of researches, such as transgenic mice, research of dendritic cells, which is important to immunity against cancer and pathogens for the basic medical sciences research, and the researches of peptide vaccine as a cancer immunotherapy for clinical medical sciences research. Besides, Intellectual Property Management Center was established and strives to promote the intellectual property management and utilization. At the Center of Innovation, Medicine and Science, we are working to simulate drugs discovery and clinical research through industry-government academia collaborations as well as joint research with the School of Medicine, School of Health and Nursing, School of Pharmaceutical Sciences, and affiliated hospitals. Also, we installed the industry-government academia collaboration promotion headquarters and work actively through pan-industry social events and in collaborations with engineering, agriculture, and companies. Wakayama Medical University has held wide varieties of international society. We foster nurses and public health nurses at School of Health and Nursing Science, and more than 300 students study. The curriculum consists of 3 fields: the field of liberal arts, basic field of health and nursing science, and specialized field of health and nursing science. Students can learn in an interdisciplinary and integrated way, beyond the frame of specialization. School of Health and Nursing Science offers master, doctor, midwifery, and foster cancer nursing specialist. The Faculty of Pharmaceutical Sciences trains students to become pharmacists. Students learn how to become medical professionals from the first year through care-centered education in collaborations with the Faculty of Medicine and the Faculty of Healthcare and Nursing Science. From the second year, students begin to learn the basic knowledge required for pharmacy. They also devote time to the study of English until the third year, acquiring the English skills necessary to communicate their research results to the world through academic papers and international conferences. The School of Pharmaceutical Sciences provides a 6-year course of study for acquisition of the knowledge, skills, and expertise necessary to development of medical professionals and researchers that can play an active role in both local and international society. The affiliate hospital has a wide range of departments. 13th floor building, 800 beds, accept about 1,500 outpatients a day, 5,000 emergency patients each year. We have introduced helicopter emergency medical service with a flight doctor and a nurse. Our helicopter emergency medical service base was established in 2003, which was the 7th in the country. We have about 450 dispatches on the average every year. There are a lot of mountains in Wakayama. However, the helicopter can reach the site 100 km apart within 30 minutes and start the treatment on arrival. It also allows the doctor to quickly provide on the spot the initial treatment upon arrival. Installing MDCT and angiography equipment in the critical care center enables to treat patients in the center. Our critical care center service has received highly evaluated in the nation. In the hospital, about 9,000 surgeries are performed each year in 19 operation theaters. The hybrid system provides minimally invasive therapy with both open and percutaneous procedures, including cardiovascular and orthopedic interventions. We have surgical support robot Da Vinci. Recently, almost all operations of prostatic cancer are performed by Da Vinci. Elsewhere, operations of nephrectomy and colon cancer are also performed by the surgical support robot. For cancer treatments, the tomotherapy system has been introduced apart from general LINAC devices. We have also opened a high-concentration oxygen therapy room where 2 units of hyperbaric oxygen therapy are available. We have 9 beds of neonatal intensive care, 18 beds of growing care unit. Our hospital has been designated as disaster-based hospital. In 2019, we dispatched doctors, nurses, and coordinators to the Diamond Princess cruise ship in response to the emerging COVID-19 crisis. Wakayama Medical University plays a central role as a base of medical cooperation in the prefecture. Also, doctors who train in the university has worked in almost all of the public hospitals in the prefecture, has been responsible for the medical care of the citizens. In addition, Wakayama Medical University has increased the number of the students engaged in community medicine for the protection of doctor shortage in the prefecture. Since the 2008 fiscal year, establish a community medical support center in order to support the career development of postgraduate and carry out remote medical care and lectures between public hospitals in the prefecture. In Kihoko Hospital, we provide a highly quality medical care with a focus on comprehensive medical care and spiral care center. We practice medical care in close contact with the community to aim the center of the comprehensive medical care, working together with medical, nursing, welfare, and health. We set up the Medical Center for Health Promotion and Sports Science in the center of Wakayama City. We provide medical care with an emphasis on such as lifestyle-related diseases, as well as we conduct research of sports medical science that uses an environmental chamber and 3D movement analysis system. Wakayama Medical University is designated in the Joint Usage Research Center of Sports for persons with impairments. University has actively encouraged the international exchange. Those are universities that we have signed the agreement. Universities in Asia, Europe, and the United States, including Shandong University in China for over 30 years. Besides, there are a number of universities exchange students and residents. Wakayama Medical University as the center of academic, related to medicine and health nursing, teach and study from basic to comprehensive knowledge, advanced and specialized academic to foster high-quality human resources with rich humanity and lofty ethics. By meeting the expectation of citizens, such as improvement of community medicine, we contribute to the development of the region and the improvement of the health and welfare of mankind.